I want to go to the audience now and see if there's any particular kind of health shocks, either as an input or an output. We stole your terminology from yesterday, Charlotte. As an input or an output to resilience that you think are important. I mean, we're telling a lot of stories as well as giving you some kind of quantities, but let's go around and get some of those things. Do we have other microphones? I can pass this one around. Oh, this one here. Okay. So keep your hands up, and then Mike will start, and then the next person should have a mic.
Yeah, thanks very much. Mike Jones from IUCN's Resilience Task Force. One of the things that I think is important is the connection between physical health and mental health. And I'll speak to that from personal experience and also from experience with an impoverished community. In my own case, I've been through two potentially life-terminating experiences. I came through it partly because of the social support that was available to me, both in terms of people who wanted to help and in terms of the medical care that was available to me. But the other part of it was my own ability to respond positively in a mental way to the kinds of disasters that I experienced. So that's at a personal level. At a community level, I'm working in a place in the United States now which has been plunged into poverty by the collapse of a local industry. Consequences of that are an increase in the rate of suicide, increase in domestic violence, increase in substance abuse, increase in school delinquency. A lot of these are related to mental problems. So it's poverty and physical health and mental health. Thank you.
Thank you, Mike. That was a huge contribution. Yeah, Douglas.
So my name is Douglas Steinberg, and I'm with Helen Keller International. We've been talking a lot about shocks as being very negative events, but we can also flip it around and look at some gains in health systems. And I'm just thinking of a case that a colleague of mine in Sierra Leone reports to me frequently. Since the end of the war in Sierra Leone, the child mortality rate it's phenomenally, it's dropped down in a phenomenal way, and it's really close to attaining MDGs on child mortality. It's really a case study in success. And my colleague who's a public health person, takes great pride in her minor role in it, but she's also afraid because she sees a wave of children who are going to school in a school system that's not at all prepared for it. So you can see some of the health gains we have. Perhaps control over elimination of river blindness opens up new areas to population pressures on the ecology. So there are, what would you say, the shady side of success as well.
Yeah, exactly. And malaria is another huge one, I think. Yeah. Can you just pass it back here?
I'd like to build up on Howard and the stories Howard mentioning that you increasingly have the risk to die when you go to hospital, and the almost end of the world narrative and so I'd like to read from you guys about the increasing cases of resistance to antibiotics, and whether your big program, John, is actually looking at that issue.
Okay. Yeah, we'll come back to that. Yeah, both of you. Yeah, you may get different answers. Yeah, back there. Can you pass the mic? Yeah, I think there's only one mic. Let's open the other one.
We have an interesting group of people discussing on the malnutrition and also on the health issues. It was interesting to hear from Delhi also that the zoonotic diseases are increasing day by day. What's the linkage between the malnutrition and the immunity losses and the increases in the zoonotic diseases? That's
yeah, and that should come into the solutions clearly because they're joined up. Who else? Getting some good additions here. Can you pass the mic to Kaba? Yeah, okay, just.
Thank you. The first speaker talked about the father's death. But far more important is the death of the mother. The death of the mother, the family sinks very fast into poverty. The death of the caregiver is a major event in the family. And it's really catastrophic. And you also mentioned and the other thing to think about, somebody talked about context. But family size also is important in rapid transformation. Some people say family size probably sometimes is an advantage because you have more hands in the field to work. But sometimes it's in large situations, it's a disadvantage in terms of the health of the family. And usually, when you look at the size of the family and you look at the health status, you look at certain indices, you find out that large families, very large families, don't do very well when it comes to the health indices. Finally, just to give some experience, we wanted to immunize the kids in a pastoral situation. And we thought the best thing was to send notice around in their own way to say, look, all of you should come to a particular spot and we'll immunize all your kids. It failed. It failed miserably. And then we said, let's learn from the vets. The vets go to the cattle. Why can't we go to the kids and get them immunized? That made a lot of difference. We got more kids immunized than we waiting to collect them in a particular spot and get them immunized. The other point was sharing facilities, sharing because as sometimes some villages are tired with a series of government people, the health people, the vet people, the economics people, the rural development people. They come one after the other. And then as we said to them, look, why can't the agric extension worker, the health worker, the rural development worker go to the village at the same time in one vehicle? Make a lot of difference to the villagers, so they can see the villagers at the same time. That was a major breakthrough in the village villages that we work.
Thank you, Kevin. You, like a true public health person, you moved us onto the solutions quickly. Lawrence?
Thank you, Joanna. Thank you, panelists. Often the role of communities in development is kind of overhyped. But it seems to me that in this particular issue of preventing shocks that are not big aggregate shocks, it really may have a very strong comparative advantage. I'm thinking of, first of all, microfinance, prevention of financial shocks, microfinance, getting open defecation-free communities as a way of preventing a lot of the gastroenteritis stuff. And then Harold mentioned community-based management of acute malnutrition. Do you feel that this is prevention of shocks that are not big aggregate shocks? Do you think this is an area where the community can really come into its own? And can you talk a bit about the challenges that poses for public policy to engage meaningfully with communities?
So that'll be nice to weave into your solutions. Good, thanks. Susan, try and keep it to the issues we've missed. Everybody likes to move to solutions, which is good. And we'll come back to that as well.
So Dr. Krishna, I believe that Susan McMillan from the International Livestock Research Institute, I believe that your study also found that of all the assets that were depleted when a household started to go into poverty, livestock was number one, whether it's the widow who has to kill the bull to serve all of the people, or the milk goes to tea for 100 visitors, etc. So if we, well, I won't suggest an option.
Okay. Yes, please. This lady here. Yeah, and then you can move it across to the gentleman.
I'm Mercy from SEAT. I'm concerned about the intergenerational effects of shocks. I work in 3 countries in Eastern Central Africa where climate and conflict-related shocks have been very recurrent. And you have mothers who, although they have the resources, do not provide diverse diets to your children because mentally they're always preparing for the next shock. So how do we develop tools that also address these issues that may not be very obvious to people who do not live in this environment?
One is a question. about the poverty study that has been done. When you saw those people moving out from poverty, what were the reasons for that? And we talk a lot about poverty traps, and these are very non-linear things, and there is quite a lot of connection between health, education, and malnutrition. And we're talking about resilience, and resilience of the current systems is not useful. What we are trying to do is that we have the systems has to come out from current state into a better food secure state, and that's when we have to talk about resilience. The current effort has to be about transformation of the current system, because the current system doesn't work. Just a comment around that. The other one is the connection between effects of climate change and health in particular. There are lots of issues that have been highlighted would be affecting us quite significantly. Heat waves and other insect-borne diseases, which might be difficult. And if there is any comments around that.
A couple more, yeah. The lady back there.
My name is Tiffany. I'm at USAID, and I just wanted to know if I have a question. If the panelists could make an explicit connection between their work and resilience. So I'm having a hard time determining how the examples that you've given or the work that you've talked about aren't just examples of good programming having positive outcomes. So what kind of value added, very concretely and specifically, has resilience offered to the way that you've done work in the past or the way that you see potentially doing work in the future? Thank you.
Okay, thank you, John. My name is Isaac Njoro Zendeu. I'm also from USAID Nairobi. My question is mainly to Delia and Jacob. In terms of the animal health, the delivery systems in the region, especially in the pastoralist system, of course we are aware that we don't have adequate veterinarians, and that means a lot of drug is administered by the less qualified people themselves. Is there a danger in terms of drugs misuse in those areas, and is there an impact in terms of resistance, in terms of the diseases, and maybe trade, or what is the general impact of this? Thank you.
Okay, I'll take just one more from here, and then I'll
Okay, Hung Nguyen from IFPRI, Vietnam, and Hanoi School of Public Health. I have the feeling that our panelists and the audience focus very much on kind of, the shock coming from nature, climate change, drought, disease, charcoal, pastoralist system. But also, Delia touched a little bit about the safety and water and this kind of thing. And in the developing context, sometimes, the shock coming from human is also very important and cause a lot of losses in terms of, human health and animal health, and even economics when you talk about. For example, in Vietnam a few years back, there was a really big shock because, in livestock sector, farmers, from small or big scale, they use kind of beta agonist kind of, growth promoters for fattening pigs. And that's actually, we discovered, and it destroyed for a long time the pig industries in the country. So that is rather from the economic point of view. But, also we think also that the health impact is also crucial and huge from this kind of thing. So I think I would see also, apart from all this climate change and things like this, we should think more also about, the shock really coming from human impact, and the antibiotics resistance is also some of the things in that line.